Who don't know me, I'm Lauren. I am a physical therapist and I work primarily in the MS clinic. So what we're going to talk about today is a very broad topic that I was assigned, which is wellness in MS, diet, which we nailed with the cookies, exercise, and then alternative therapies. So most of you have probably seen this picture before. So I like to put it up there because it really just highlights so many different things can play into what we talk about when we talk about MS or wellness. So we're going to define wellness in two different ways. So one is kind of the individual definition, which is the quality or state of being healthy in body and mind, especially as a result of a keyword, deliberate effort. The healthcare definition that I like to use is an approach to healthcare that emphasizes preventing illness and prolonging life, as opposed to the emphasis of just treating the disease itself. So at OhioHealth and here in the MS clinic, I feel like we do a really good job of talking about taking care of all different aspects that come into play when we're talking about MS. So as many of you know, you can have a slew of different symptoms that when we take a wellness-based approach to tackling it, we can start to chip away at these things. So looking at almost 50% of people report walking difficulty, muscle spasms, fatigue is definitely higher than 40%. That I would argue with. Bladder dysfunction, depression, all those different things. So the dimensions of wellness that we're really going to focus on today are physical, emotional, and then kind of tying it into the social dimensions. So my favorite is physical wellness. So we're going to talk about the importance of exercising regularly, eating a well-balanced diet, avoiding smoking, and managing stress. So you're all here today because you're probably interested in what else you can do. So I really want to highlight as well that this is an integrative approach to medicine. So it's healthy lifestyle practices that we want you to follow, and they're intended to complement what your physicians and providers are recommending from a conventional therapy standpoint. So your disease-modifying therapies. Everything we're going to talk about is in addition to adhering to your DMT, which is the most important thing that you need to do. So comorbidities are coexisting disease states that are distinct from MS. So we need to know what comorbidities are and how they can affect disability in MS. We know that comorbidities impact our health-related quality of life and they increase our risk of hospitalization. So we're going to talk about that, and then we're going to talk about kind of steps to achieve wellness after we address this. So obesity prevalence in MS is pretty high. So when we look at the studies that are out there, most of them are self-report, so there's some limitations with that. You know, everyone's scale is different. Are people kind of reporting their driver license weight? You know, all those different things. But there is a very high incidence of individuals who are overweight or obese in MS. Upwards of 50% of the population falls into that category. However, more research is needed to compare it to the general population. But what we want to look at is what is the impact of obesity on MS. So some studies have shown that there is a correlation between higher BMI and then a higher EDSS score, which is your expanded disability status score. So just looking at progression of disability, those individuals who have a higher BMI are more likely to have that. But it's insufficient evidence to say it's a strong association at this point, just looking at MS. But what we do know is in the general population, incidence of obesity is tied to other risk factors. And interrupt me at any time if you have questions, but we will have time for questions at the end. Did I skip that? So the other thing that we know is that there's evidence for a possible connection between obesity and immune system dysfunction, and that's related to kind of the fat cells secreting inflammatory chemicals, and we know that MS is inflammatory in nature, so having a higher BMI could increase the likelihood that there's inflammatory chemicals in the body, which is not a recipe for good stuff, it's a recipe for disaster. We also know that obesity increases your risk for heart disease, high blood pressure, diabetes, all those things. So even if we can't correlate overweight and obesity to disability and MS, we can correlate it to other risk factors, which we're going to talk about next, which are vascular comorbidities. So these are the high blood pressures, artery disease, high cholesterol, diabetes, you name it. So when we look at the research, there's an association between having a vascular comorbidity, so any of the things that I talked about before, and having more lesions on your MRI. Now, when we add a vascular comorbidity to being overweight or obese, that has shown to have an increased lesion volume on MRI. And then when you look at ambulatory dysfunction or walking difficulty, for every vascular comorbidity that was reported, the incidence was 50% higher ambulatory dysfunction, and a mean time of onset to walking difficulties was 6 years earlier for those who had those vascular comorbidities. So we have to talk about the scary stuff so we can talk about why it's important to be healthy. So, all right. Other things that were correlated to vascular comorbidities were visual disability, anywhere from 37 to 50% increase, whether it was mild, moderate, or severe. And then every time you're adding on a comorbidity, you're increasing your risk for all those other things that I talked about. So hazard of death with vascular comorbidities is obviously higher. So shifting gears to mood disorders. This I find really, really interesting, and I actually think some people were having discussions about this earlier. 60% of the population of MS report at some time of their diagnosis having some sort of mood-related disorder. But of that 60%, less than 50% of people receive treatment for that. What we do know is that there's higher rates of bipolar, higher rates of depression, higher rates of anxiety in the MS population. And we know that all of those different mood disorders can negatively impact our quality of life, our energy, which is very important, our thinking, our cognition skills, and then our perception of our own health. So sometimes that ability to take the next step and do those things that you know will positively improve your health, if we're not getting treated for depression, anxiety, things like that, that can sometimes be your barrier. So different lifestyle factors. So these are things like we're going to talk about vitamin D levels and smoking in MS. So we know, and I'm sure all of you have had your vitamin D tested, but we know that lower levels of vitamin D are correlated to increased disease activity, and that people with higher levels of disability were more likely to be vitamin D insufficient. On the flip side, those who had high levels of vitamin D, that was associated with decreased MRI activity. So a 15% lower risk of having a new lesion on MRI, so that's a good thing, and then a 32% lower risk for having one of those enhancing lesions or active lesions. And those who had high levels of vitamin D had less disability.
Is there a limit on how high you can go?
Yes. So I believe in the MS clinic, they want you to be between 50 and 100. So
if you're over 100, that's
I don't think that,
slow it down?
I don't think that's better for you. They want you to be there. I think there's negative impacts of being too high, so like vitamin D toxicity, things of that nature. So tobacco smoking. So there have been no studies that evaluate tobacco smoking and disease activity. However, there are a lot of studies that evaluate tobacco smoking and long-term outcome and disability. So there is a demonstrated risk of disability and worse long-term outcomes in smokers versus non-smokers. But then current smokers compared to previous smokers have a higher risk. So even if you are a current smoker and you stop smoking, you improve kind of your likelihood of not developing as much disability upward to almost 7 times fold. So if you can stop smoking now, it's still a good thing to do. Some people tell me, well, I've already done the damage. But the research shows us that if you stop smoking, you are actually at a better chance to not develop more disability. So now we talk about the positive stuff, right? So we have to understand what the negative implications of unhealthy lifestyle factors can be so that we can have kind of motivation to take the steps forward. So now this is where everyone smiles at me and they don't look at me like I'm crazy. So starting with the last things that we talked about. So vitamin D. Vitamin D3 supplementation is preferred over vitamin D2 because D3 is more active biologically and it's more stable on the shelf, all those different things. But like we talked about, so the levels that we want in the clinic are 50 to 100, but it's very individualized to the patient. So your provider needs to test you and then give you recommendations on what you should be taking over the counter, so don't just run to the store and start taking it. Talk to your provider about it because everyone is very different and where their levels are and how much you absorb, all that kind of stuff. So the most effective way for tobacco cessation is combined behavioral, which is kind of group therapy, individual counseling, educational materials, and then pharmacological interventions. And if you talk to your provider, they'll give you lots of options. And if you remember to what I just said earlier, even if you are a current smoker, if you stop smoking, may the odds ever be in your favor. Horrible Hunger Games reference. So I think this is the hottest topic, is nutrition. So what we know is that food is fuel. So general healthy lifestyle factors are very important. Everyone should be eating a well-balanced diet. But what we don't know and what everyone wants to know is what is it going to do for MS, right? So there's currently a lack of high quality evidence to support a very specific diet in MS. Some of the diets that have been proposed and haven't been well studied actually can be associated with negative things. So lower levels of vitamin D, lower levels of vitamin E, all things that we want. So we're going to kind of break down what different studies are out there so that when we talk about nutrition and MS, we're talking about it from an educated standpoint. So RCT means a randomized controlled trial. And why that is important is because that's the highest quality of evidence that we can have. So the only study that falls into that category of being high quality evidence is one that looked at a low-fat, plant-based diet. So this trial was long in duration. It was a year, so pretty good length, but it had a very small sample size. So I'm going to talk to you about all the limitations of the studies that are out there as well, just so we can put it into perspective. What they saw in this trial was that there was no difference on the MRI, relapse rate, or disability at 12 months pre and post. But what they did find is that the group that followed the low-fat plant-based diet had significant improvements in fatigue, which is a good thing, and significant reductions in their BMI. So again, helping reduce those comorbidities that we talked about earlier for those individuals who participated in this study. This trial is an observational trial, so it doesn't really fall in that high quality of evidence, but there were some interesting things that were found. So they looked at a high sodium diet, and they found that those who followed a higher sodium diet had anywhere from almost a 3 to 4-fold increase in relapse rate. So that's not good, right? So what they determined was that there was a correlation between high levels of sodium in our diet and MRI activity. And the way that they gauge this, so they had average sodium intake was 2 to 4.8 grams per day. And if you fell into that average level, you were 2.7 times more likely than those who had less than 2 grams. And if you had more than 4.8 grams in your diet, you fell into the 3.95 fold than those who had less than 2 milligrams of, or 2 grams, milligrams would be nothing, per day. So this is a very, very small study that was done that looked at intermittent fasting, which I feel like is the hot topic in general right now. They looked at people who were fasting during Ramadan, and they found no significant changes on any of the measures that they looked at. So no significant changes for disability ratings and no significant changes on relapse rate. So it's kind of, you don't eat for a certain length of time. So they talk about kind of lowering your blood sugar levels and then eating and then lowering them again. There's a lot, what?
Like plunging?
Yeah, kind of. There's a lot of mixed ways that it's defined. And so that was one of the other things is when they're talking about fasting during a certain period of time. I mean, if you're binge eating right up until the minute that you start your fasting, you know, there's no control to the trial. So then this diet, so the modified Paleolithic diet, this was a multimodal study. So the reason that's important is because they did a whole bunch of other things, right? So there was only 8 participants, so that's really, really small. And of all the things that they did, they had the poorest adherence to the actual diet itself. So the other things that they did were, they had a group who did electrical stimulation, meditation, massage, exercise, supplementation. I mean, they did everything. So the only improvement that was seen was in fatigue, which is a good thing, but the bad thing is they can't correlate it to the diet because everyone did a bunch of other stuff. And again, 8 people is like, you know, a drop in the bucket. Now, the reason I even bring this up is because the WALS protocol that a lot of people talk about is a modified kind of paleo diet that is based on kind of personal experience. And right now, there's no formal research that has been done on this. However, in preparing for this talk, I obviously wanted to pull up all the different stuff that was out there on nutrition and diet and MS. And there was kind of a proposed randomized controlled trial, so very good, that's going to evaluate the effectiveness of the WALS protocol. So hopefully by the time that I give this talk again or a different variation of it, we'll have some data to say, does it really work? Because there are a lot of people who anecdotally feel better when they eat healthier. But the general population, the better fuel you put in your body, the better you're gonna feel. So I think that's really important to think about. So based on the data that's out there, the only recommendations that we can give for diet currently are to have a low salt, low fat diet. And when we talk about low salt, it was less than 2,300 milligrams or about 2 grams per day. Plant-based, high in fruits and vegetables, having a variety of proteins and high fiber foods. This is truthfully the diet that's recommended for the general population. Heart healthy diet, all those things. You want to limit your added sugars, limit processed foods. And this, hopefully, you'll then see the correlation of reduction in fatigue with eating healthier. So my favorite topic. So I'm sure everyone has been told that they need to exercise in some way, shape, or form. So we know that exercise is beneficial in MS. And when we talk about kind of alternative therapies or complementary therapies, exercise is the one topic that has the most research on structured exercise programs that correlate with functional improvements and improvement in symptomatic outcomes. So that's why I like talking about it, is because there's actually data to back it up. So we know that with regular exercise, you're going to see improvements in endurance. We know that you can see improvements in strength. We know that you can see improvements in mood and attitude, which was also something that was high on the kind of comorbidity standpoint with MS. We know that it's going to improve your fatigue. We know it's good for bone health, and if any of you came to that presentation, she talked about some of the different types of exercises that you should be doing. We know that it can help improve bladder and bowel function. It's good for weight management, which is, again, another comorbidity that we talked about. And it can, right now all the studies look at short-term improvements, but it can in the short term lead to improved memory and cognition after the fact. What we also know is that failure to exercise leads to deconditioning, which leads to secondary weakness and fatigue. So when we talk about exercise guidelines, this has kind of been shifted. So if people have heard me talk about exercise in the past, we always talked about low to moderate. We're kind of getting rid of the low intensity side of things. So at a minimum, we should be exercising at more of a moderate intensity. And when we talk about moderate intensity, you should be breathing heavy and able to say a sentence, but you shouldn't be able to maintain a conversation necessarily. You always want to listen to your body with anything that you're doing. Overdoing it will not help you. It won't hurt you necessarily if you over-fatigue yourself. This type of fatigue rest is therapeutic, but it doesn't feel good to overdo it. Take rest breaks as you need, and then in general, obviously plan exercise for times of the day when you have the most energy. Now, there has been a lot of new research that's come out looking at high intensity exercise as actually being well tolerated and beneficial. And when we're talking about high intensity exercise, we're talking about getting that heart rate up into the 80th percentile. We're talking about doing shorter bursts, so a minute, 2 minutes, 3 minutes, and then recovering. So not the do it for 30 minutes and sustain it. Get it up there and come back down. Get it back up there and come back down. So when we're talking about the endurance piece of it, if you're doing it at a moderate intensity, it should be 3 to 4 times a week. And there are going to be, throughout the rest of this talk, a lot of durations. So I always say, start at the bottom and work your way up. So if you are not currently exercising, you're not going to jump into 4 times a week for 60 minutes because you're not setting yourself up to have a good outcome. You're setting yourself up to overdo it and be over-fatigued and then not sustain the activity. So you can break it up. If you want to get 20 minutes, you can do it 10 minutes in the morning, 10 minutes in the afternoon. That's fine. I really don't recommend starting at less than 10 minutes in duration because you're not going to see the benefits of the cardiovascular conditioning if you do less than 10 minutes. Examples of moderate intensity can be walking, stationary bike, water aerobics, spinning, whatever you enjoy. But again, any exercise can go from low to high. It's all the effort that you put into it. So walking can be a low intensity exercise or a moderate intensity exercise.
I've got a question.
Yeah, of course.
Talk about weight-bearing exercise being good,
Yeah.
which you don't get in water aerobics, and I don't think you really get it on a stationary bike.
You don't get a ton on a stationary bike. You are going to get it in walking. One of the things that I find sometimes with weight-bearing exercises when we're talking about cardio is people who have a lot of motor fatigue have difficulty sustaining it for the amount of time that you need to see the cardiovascular conditioning.
Yeah.
So that's where we have to say, what is the target here? And if the target is to improve our endurance, then we have to adjust the exercise so that we can achieve our target. So coming to a seated position or getting in a pool might be something that you can sustain long enough to get that benefit. But that also means the other activities that we're going to do from a strengthening standpoint, you should try to have in the weight-bearing position. So you are getting the weight-bearing. Or if you can sustain 10 minutes of weight-bearing exercise before motor fatigue kicks in, do you do that 10 minutes, 10 minutes, 10 minutes? And break it up throughout the day, because you'll start to see some cardiovascular changes at about 10 minutes and working on that endurance. Do you flip gears and do the circuit training? So 5 minutes of cardio, strength training, and so on. So this is where going to see a therapist or going to see an exercise professional who understands motor fatigue and all these things is so important, is because we're going to customize the program to you. Great question, though. So strengthening. We want to be doing strengthening 2 to 3 times a week. A minimum of 10 to 15 minutes total in duration, targeting all the major muscle groups of the body. I like to start at the 2 sets of 10 to 15 repetitions. Again, if you've been exercising for a long time, we can definitely play with where you are. So you may have lower repetitions because you're trying to, bulk up and you're trying to do higher weights, or you may be going for motor endurance and want to be in more of the high repetition range. Everyone should be doing flexibility and stretching exercises daily, especially if you experience any stiffness or spasticity, muscle cramping, things like that. Stretches should be gentle and prolonged, so stretches should never be painful. You're looking at 30 to 60 seconds for holding it, and a total of, 10 to 15 minutes. It can be broken up throughout the day. You can stretch at your desk. There's lots of different ways that you can stretch. It doesn't have to be a huge chunk of time. The most important thing to think about when we're talking about exercise is consistency. If you exercise today and you don't exercise for 3 weeks, you're not going to maintain what you just tried to build. Okay? So it has to be something that is a deliberate effort, and it has to be sustained and consistent. Now, if you're sick and you don't exercise for a week, are you going to lose everything that you did for the past 3 months? No. But if you want to continue to see the improvements, we got to stick with it. So we talked about exercise, and then we're going to talk about kind of mood. So this is the one thing you definitely have to talk to your provider about. Remember that you're not alone. If you remember what I said earlier in the presentation, over 60% of people at some time throughout their journey with MS report difficulties with mood. There are a lot of non-drug related interventions that you can ask about. So there's cognitive behavioral therapy, which I'm a physical therapist, so I don't know that I can speak to it 100%, but it's more kind of how do you view your situation and what can your outlook be? Motivational interviewing. And then through the MS Society, something that I didn't know until I looked into this, there's a navigator program that will help you connect with different mental health providers in your area that specialize in MS and mood-related conditions. So that's something you can look at. Stress management is very, very important. So things that have been proven to be effective when it comes to stress management are mindfulness training, so using different techniques such as breath awareness, body awareness. A lot of different yoga postures and poses have been effective. Really diving into stress management, even with the cognitive behavioral therapy approach, has been shown to improve health-related quality of life, depression, and fatigue. So we offer a lot of these different things here at OhioHealth. So you guys are all at the Dempsey Center. If you've never been here before, you should really check out what they have out there, because there are things such as art therapy, music therapy. We have a free neuro yoga program here. There's the classes that I teach. So there's an MS wellness series. There's an MS fitness class. The neuro yoga is general neuro. There is an MS specific yoga class down in the short north. And then there's the adapted sports connection. So if you're interested in trying to pursue things that you've never done before, so adapted skiing or water skiing, kayaking, things like that, there's groups that can get you out there if that's something you really enjoy. I really recommend you check it out. It's a great group. So I'm going to wrap that up and see if anyone has questions. I know we went over a lot. Go ahead.
Mm-hmm. Acids being good, so would you say that eating a lot of fish would be good for that?
Yeah. So again, when we talk about what we can recommend, we always have to, as healthcare professionals, refer back to what has been proven. And right now, there isn't a lot specific to MS that correlates that to seeing improvements. Now, Are omega-3s considered probably a better source of fat than some others? Yes. Should you have a high-fat diet based on what's out there? Probably not. So it's a good type of fat, but should that be this, like, the thing you're going after 100%? Probably not. But it's not going to hurt you. Everything in moderation is really what things are looking at. Great question. Yeah?
Is that the name of the group, Adaptive Sports Connection?
Yeah, it's formerly known as TASC. So that was the Adaptive Adventure Sports Coalition. But if you look that up, it's based in Columbus. It's actually in Powell. So last year we did a adaptive ski trip with them. That was really fun. But they do events all the time. They fit adaptive bikes. They do, some groups do rock climbing, different things that are out there. Yeah. Anyone else? Yes.
How's married life?
Married life is good.
Got married this summer.
Oh, thank you guys. Yeah.
So if I'm on the elliptical and I get off
Mm-hmm.
and walk and have trouble, more trouble than I had,
Yeah.
go in there.
Uh-huh.
Is that bad?
So the question kind of ties back to motor fatigue. So you get on the elliptical, you get off, and you kind of have everyone who's exercised with me knows that I call it baby deer legs, right? You feel like you don't have any stability.
Right.
So is it going to hurt you? No. However, if you're putting yourself at a high risk for falling, then yes, that could be a very bad thing. Rest is therapeutic with that kind of fatigue. I would challenge you to think about your exercise program differently. So how long are you getting on the elliptical for?
Well, I have been on it for 25 minutes.
Yeah, so maybe cutting that in half. Getting on for 10 minutes, getting off. So I kind of structure my class in a circuit. So we do some high intensity cardio, then we get off and do more core stability, more upper body strengthening, letting the legs recover, maybe going back to the elliptical if you wanted to finish off that 10 minutes, or switching gears to lower body strengthening. So it's not the duration of time that's a problem, but if you don't have enough energy to be able to do the strengthening afterwards, it's probably not what our target should be. Yeah, does that answer that?
Yeah.
Okay. Anyone else?
So when you talk about alternating, for years I found I could go and do like I liked to go to a gym and use the weight machine.
Yeah.
And stuff like that. And then I would go and do the bike, but I didn't do them both on the same day.
Yeah.
I would alternate days. And then I moved here and it was, oh no, I have to do it on the same day. And to build endurance,
Mm-hmm.
but I decided
Yeah, so the question,
I'm not there.
yeah, the question was about
I have a hard time.
usually alternating kind of bike strength training versus doing it all on the same day.
Yeah.
There has been no evidence that I have read that says one is better than the other.
Okay.
As long as you're hitting your targets, which are kind of in those durations, so that 20 to 60 minutes, which again is very large, the correct amount of days, and then I like to think of alternating muscle groups as well. So you don't want to always do upper body strengthening
Right.
or always do lower body strengthening. Every muscle in the body is important. But yes, and especially how much time you have. If you are working full time and you only have 30 minutes to exercise, well then probably alternating per day would be most effective. If you can only get to the gym 3 days a week, then maybe you need to do everything the same day so you're getting the variation that you need. It's very individualized. So you are not wrong for alternating.
Thank you.
You are not wrong. I'm glad you're doing it. Yes.
I can't do it all in one day.
Yeah, that's okay. That's okay. Does anyone else have questions? Comments? No? Well, you guys are done early. How long till the next class comes in? Okay, so I'm in my 7th round of teaching the MS Wellness series, which is amazing. And we are halfway done. This is week 7. So you'll get some new faces. And if you are interested in an MS Wellness program, an MS fitness class, there are definitely things when you go to your next appointment, please talk to your provider, and if it's a good fit for you, then we can definitely get you signed up. We won't run one again until January though. Nobody wants to exercise over the holidays. It's too hard to reschedule all those classes.
Are they here?
They are not here. They're at, well, it depends. So we have some on the east side of town. We have them at McConnell. We have them at the Gerlach. And then hopefully, come the new year, we'll be up and running in Delaware again. I can't guarantee that, though. We're trying to work with the YMCA. So.
What is the wellness series?
So the wellness series is a 12.
You up for 12 weeks.
Essentially, yes. So the wellness series at OhioHealth is a 12-week program. So we have kind of a really high intensity class, and then we have a mixed level class going. So the mixed level class has more options for seated exercise if you have a lot of motor fatigue, and then the higher level class it really is hard. I'm not gonna lie. I put you through your paces. We ramp everyone up accordingly, but it's not for the faint of heart.
And it starts in January, you said?
I'm gonna have another class in January.
And is it down here or up in Delaware? Or?
For sure the one here will be going in January. The one in Delaware is still pending other people other than myself.
Is the one here?
No, it's at McConnell.
McConnell?
Yep, which is just right around the corner.
Yeah.
Yeah.
So then what's MS Fitness?
MS Fitness is the mixed level class.
Oh, okay.
Yeah, so the MS Wellness class is the really high intensity. We do spinning. I mean, you name it, we do it. That comes along with lecture. It's a little bit more of a commitment. It's twice a week. MS Fitness is twice a week, but if you can't commit to coming twice a week or you're just gonna drop in, that one is kind of just open to everyone.
Mr. McConnell, is that you have to be a member?
You do not have to be a member for the class, but you cannot use the facility outside of class. You can just come and you have to be with me. Sorry.
So the one with the spinning is the high intensity?
Yes.
Okay.
Yes.
And that's the one that you do?
Yes. Yeah.
You can do spinning if you don't know how to ride a bike, right?
Absolutely. They don't move. They're stationary. I will tell you that your butt will hurt for the first few weeks, but it gets better. These guys can vouch for me. Does anyone have other questions? No? Thank you guys for coming out. If you have a question that you want to ask me after class privately, you absolutely can't. Class. This is not class. Lecture. All right, guys. You're free to go. Grab a cookie on your way out.